Welcome to the Wellness Table. I'm Dr. Cheryl Bothwell, and on this show, we're going to talk about nutrition, longevity, and lots of fun things. Today on the show, we are going to talk about the leading cause of death that we don't talk enough about. So as a dietitian, and when I did my undergraduate work at Loma Linda University, we learned so much about nutrition and about food and how do we use food as medicine. And that's really so much about like the therapeutic side of it as well. If someone's in the hospital and we learn what's the diet, what's the best diet for this and for this and for this. So ultimately, we're on the treatment side. And so in my doctoral work at Rutgers, we had to do a residency. And in that residency, it had to be with a physician and it had to be in your specialty. And my specialty area that I focused on in my doctoral work was cardiometabolic disease. So diabetes, cardiovascular disease. I was trying to just look at the big number one chronic diseases. And so when I did that work during my time and in my residency, I had the privilege of working with a cardiologist. And I spent 6 months with a cardiologist. And the thing that was so interesting to me is day one, I've done everything like, what's the special diets for this? I think I'm going to be seeing his patients and talking about nutrition and heart disease all day long. And the first day one, and this was Dr. O in St. Helena at the St. Helena Hospital. And he just says, put all your notes away, about nutrition. You've been studying it for 15 years. And I just want you to learn everything about the heart and everything about real people. It really changed everything for me because I spent 6 months of time in the cath lab where I would see a patient on the stretcher and he'd say, you can't look at the medical record. You can't look at anything about this person. You don't know any vital statistics. I mean, we're sitting there, what's the blood pressure? How much does the patient weigh? What's their medical history? And he would just want me to look at them and then assess, what do you think we'll find when we look at the coronary arteries? And it was like this projection of what I would find. And so it was pretty exciting because as I experienced really true cardiovascular disease, he would just joke and say, I'm really a plumber. And that really, if we think about all the vessels in our body and all of our arteries, it's like a hose and it's like water's flowing through the hose. And we need that hose to be supple and elastic. And so what we would find is that when we'd go in and they'd enter the catheter to start this coronary, we're in the cath lab, we put in that catheter. And what I found is that for some people that needle would go in smooth. Sometimes that needle would go in and it would be like hitting a block of wood. It was like hard. And I began to see he would look at me and say, hardening of the arteries, the old term, is like a real thing, like the artery actually can get hard. So he ultimately explained to me that blood pressure was a really, really big deal and a great thing to track and understand as we were assessing patients. Sometimes people ask, what's the diastolic? What's the systolic? And what's my number mean? So just in general, so we're all on the same page, the systolic blood pressure is the top number on your blood pressure. And so that's usually the highest number. And when we look at a normal blood pressure, we're talking about 120 is the top number, and that's your systolic blood pressure. And the diastolic would be the 120 over 80. The 80, the bottom number, is the diastolic, the lower number typically. So the systolic blood pressure being the top number is one way to really think of systolic blood pressure is we use a blood pressure cuff, and it's sort of like we tourniquet the arm and we sort of look at how much pressure does it take to have the tourniquet win is kind of how I look at it, where we have finally stopped the pressure from going down to the rest of the arm. Let's say we're doing this on your arm, then we would have stopped that brachial artery. And how much pressure does it take to literally, it's measured in millimeters of mercury, and how much pressure does it take for the heart at its workload, when it's in its full workload, to sort of shut that off. So that's the pressure, how much pressure. So blood pressure is really important for us to be measuring and monitoring. And one of the things that we see with high blood pressure is depending upon how your genetics are and how your body's made, for some people, we can see occlusion in arteries happening in the coronary arteries, or it could also be happening in the brain. And so we can have a vascular occlusion or a vascular level of occlusion, which can also cause vascular dementia. We can also get strokes from having a blockage of a blood vessel in the brain. If the blockage is in the heart, then it's a heart attack. But these are all really vessel-focused diseases. So managing our blood vessels and how we care for our blood vessels is all related to so much of food and lifestyle. Dr. Ornish's work has supported reversal with even 12 weeks with changing how we eat. And Dr. William Lee's latest research, again, supporting how we can actually heal blood vessels. So there's a lot of hope if your blood pressure is high to treat it today by one meal, lowering blood pressure, but also after 12 weeks, a longer effect, or after a year of actually even reversing and repairing those blood vessels. So this is super exciting. And this is what I call food as medicine at its very best. Thanks for coming to the table, where every week we're going to talk about nutrition, longevity, and what it means to be well. If you would like to have your specific questions answered, become a member today to get access to our weekly private podcast, Ask Dr. Cheryl, where we will get to talk about wellness together. I can't wait to see you on the inside.